scarring should I expect from breast surgery? And it all depends on the kind of breast surgery. So from breast surgery, you could have as little as a couple of tiny little millimeter stab scars. I mean, that's possible. If we're only fat grafting your breast, then you could have some tiny little stab scars and a few liposuction donor scars, which are, 4 or 5 millimeter scars elsewhere, usually hidden in devious tactical places like inside your belly button or inside a stretch mark. If you go up a notch to breast augmentation with implants, if they're small implants, you can get them in through a 3 centimeter scar in the breast crease. If it's other kinds of surgery like a nipple lift, an areola lift, then that's a scar around the areola, or sometimes around part of the areola. I don't really myself go in for those partial areola scars. I don't think they're terribly well designed operations, but that's an alternative too. Then if you move beyond that into something involving an uplift or a breast reduction, then you could have anything from a scar around the areola to the so-called lollipop scar, areola and vertically downwards, to the wise pattern scar or anchor scar or inverted T scar. Those three terms are all for the same thing, and they all just mean areola scar, vertically downwards, and something in the crease. And for those, the crease component can be short or medium or long. And finally, there are some kinds of uplift in particular called extended mastopexies, which are particularly for massive weight loss patients. And there's one on my Instagram wall, actually, massive weight loss patient, and you can see it's early days, it's been taped, it's the patient's own photo, but the taping goes into her armpit too, and that's because there's often an extension of the scar going there if there's a lot of looseness there. And when people have had really, really substantial weight loss, as the surgeon, you're kind of almost making an arbitrary decision as to where you stop tightening the skin.